Good morning and welcome to The View from Lona Ridge. I'm Leona Rocha, and in the studio with me today is my co-host for the day, Rebecca Armato.
Aloha.
And she is, if you remember, she was with a show for us a couple of weeks ago. And also with us is an administrator of the Pacific Cancer Institute. And she was talking about our guest who was on 2 weeks ago, Dr. Benjamin Falit. And that conversation was about his trying to develop the person so that you can all know about him, what his interest is, and to take the aspect. And now this show, what we really want to talk about is what he does, what his talents. Rebecca, help me out with this one.
Well, we're actually very lucky that he joined the Pacific Cancer Institute back in June of this year. And we wanted to make the community aware of him and how his studies and education have brought some new talent and expertise to the island. So, Ben, if you'd like to share with everyone how you got into radiation oncology and how and what role does the radiation oncologist play in a patient's cancer treatment?
Sure. So I never thought I would be a radiation oncologist. It was when I went to medical school. Most people don't. I thought I would be a general internist, and it was just happenstance that there were some senior classmates who were sitting around a lunch table in medical school who were talking about it. I said, wow, that sounds really, really cool. And I decided to check it out, and from there, the rest is history. What's great about radiation, I develop excellent longitudinal bonds with my cancer patients. So everybody who comes to see me has cancer, so they have a very serious condition, which I like because I can play a really integral role in their life and really help them at a very tough time, developing that personal connection with them, seeing them after treatment every couple of months, and for years after I'm able to cure their cancer. It's a phenomenal bond to be able to share with patients, and one that you can't get in many other specialties. And on top of that, it's a very intellectual field, technologically driven field. So I spend the majority of my day thinking deeply, how do I optimally deliver this radiation to cure the cancer, but limit the side effects for the patient? There's a lot of literature to know and keep up with. So it's that combination of an intellectual field with the personal aspect and that longitudinal relationship that brought me here and keeps me so engaged.
Well, I think the thing for a non-medical person, I think for me what is really impressive is that you're bringing an incredible background with you. You're young, very young. No, he's in his 30s. And, he brings an energy, which is important. Mm-hmm. And I'm sure the patients, you bring the caring, you bring the expertise, the technology. You have all the recent technology available with your experience. And so for me, looking at you, I am, as a person who was born and raised on Maui, I'm so grateful that you are here and grateful to your children that they came with you to give you a full life. Yeah. But tell me, what is radiation oncology? Specifically, what does that mean? What is it? A machine? What does it do?
Well, first, thanks for the very nice words. I appreciate that. We're happy to be here too. Radiation oncology is a very small discipline in medicine, so there aren't many of us. There are only about 200 radiation oncology residents that graduate and become doctors every year, and maybe about 4,000 in the entire country.
Wow.
So very, very small field. It's different than radiology. So radiologists generate X-rays, MRIs, and CT scans. They look at a computer and they write a report, and then other physicians use those to make clinical decisions.
Right.
For me, I'm seeing cancer patients face to face. So most of my day is spent in the clinic talking to cancer patients, meeting them, having conversations about their cancer, being a clinician. But then there's a small part of my week that's spent behind the scenes developing radiation plans. So I'm responsible for delivering high-dose radiation to patients in a safe but effective way. So as opposed to diagnostic X-rays, we use therapeutic X-rays, X-rays that are designed to treat and cure cancer. And so some part of my week is spent designing those radiation fields and plans to make sure the delivery is safe
you talk about plans. Does it differs? Obvious. I'm a novice in this area. Okay, so you're going to have to forgive me. When you're talking about plans, your patient, the type of cancer they have, and the treatment varies depending on what type of cancer or what the extent of the cancer is.
Yeah, and that's one of the great things about radiation oncology from the physician's perspective, is that it's so intellectually involved because there's an infinite amount of anatomic variation. You look at one scan, it's different than the next scan. So some parts of the body are more similar amongst people. So we treat a lot of breast cancer, for instance. Breast cancer tends to be treated in the same manner with the same type of radiation beams. It's external to the body. There's not a lot of internal anatomic variation, similar to prostate, treat a lot of because it's in the center of the body without a lot of variation. But other things like a lung cancer, the cancer can be located anywhere in the lungs. It can be near big blood vessels. It can be near the heart. So there's a lot of complexity involved there. And even in lung and prostate cancer, there still is complexity as well. So yeah, the long story short is that it's sort of custom fit radiation plans rather than off the rack.
So now, you with your expertise, and here you're coming to the Pacific Cancer Institute, and they have the technology, and I don't know if I'm using the right words, but they have the technology that helps you do just this. I'm sure you looked, I'm sure before you moved in, you looked to see how advanced the technology was here at the Pacific Cancer Institute. Is that correct?
Yeah, of course. Yeah, I wouldn't have taken a job at somewhere where the technology wasn't up to snuff. And here, the technology is as good or better than anything I was exposed to in Boston. You can do everything that I want here technologically with external beam radiation. The only thing that we don't do is the internal radiation seeds, which generally most patients aren't eligible for. There's a small subset of patients which might be eligible for that. And then I always talk to patients about that and partner with sites if patient could benefit from internal radiation. But it's common for a center that's not in a major metropolitan area to not offer that internal radiation. So we have everything that I could ever really want here.
Well, you know, I have to tell you, I just got chicken skin when you said that. I'm telling you, want to see my chicken skin? I don't know if you in Hawaii we call it chicken skin. When you said that the technology at the Pacific Cancer Institute is better than most, if not the best, and for us here in Hawaii, again, it's emotional for me, because we have really incredible fine people here, and everyone wants the best for our family and friends in the event. And what is it, 1 out of 4 now? How many people end up with cancer? Is there a statistic that anybody knows?
I don't know the exact. It's probably about that, 1 out of 4 or 5. 1 out of 5.
Somehow I vaguely remember that number. Yeah. And so for us, it's for everybody, it's very personal. And so to hear you say that we have the most up-to-date, the finest in the way of equipment, and now we have a physician such as yourself bringing in this technology, utilizing methods of working with cancer. It really is tremendously impressive. Let me ask you a question about Rebecca. You can jump in anytime.
Well, I was just going to say, I want to be sure that people know that he works closely with the medical oncologists and the other physicians on the island, and radiation done in conjunction and at the same time with patients through this. And I think that's been our biggest realization, is that people don't realize there is radiation oncology on the island, or they don't realize that they can be treated with both chemo and radiation for certain types of cancers. So the fact that he works so closely, even though he's new, out there and involved with most of the physicians on the island.
So how many radiation oncologists do we have now here at the? Well, let me just stay with the Cancer Institute. How many do you have there? One?
Well, we have one, and Dr. Baker still comes in town and visits, so he's still here as well. But we have Ben here. We need one when it's the right one, right?
Yes, absolutely. You're going to be here for a long time, I hope, and on Maui, and I hope that we will be able to avail ourselves of all your expertise. That's fantastic. So, what is it about? I have a question here because I wrote it down. Is radiation being underutilized?
It probably is in some cases. There's a lot of discussion in the literature about radiation being both overutilized and underutilized. And both are probably true, although not necessarily on Maui. Here, there's probably a few select circumstances where I feel like I'm not getting the same referrals as I Boston, but it's tough to tell. Is that because patients are underutilizing radiation? It's a different patient population. People's patient, the preferences of the patients are different. So it's tough to make a blanket statement to say that there's something wrong. It's just, I would say that the treatment patterns are a little different.
I think it's too, don't always know, and we do hear that either it wasn't discussed with them or they were so stressed out going through what they were going through in chemo, they didn't want to follow through on radiation, or they just, it's like, just give me a break,
Right.
But also just not being aware and thinking they've got to go somewhere else, a walk.
That's why this program is so important in having Ben here. I didn't call you Benjamin. That's what your mom did, right? That's why it's important for people to know, to listen to this program, to listen to what is available here on Maui, to avail themselves of the expertise that we have here. And not treatment excellent, but the convenience of the whole thing, right?
Yeah, it's very convenient. And I want to take a step back and say, I think the most important thing is to see a radiation oncologist that really cares about evaluating the patient comprehensively and as a true oncologist, and not just someone that's going to dispense radiation. The key is, if you have cancer, then you go see a medical oncologist reflexively. But radiation oncologists have as much, if not more, general oncology training and ability to work up oncology patients, manage and counsel them than any other medical oncologist or surgical oncologist. So, me, when I see a patient, I see my role first and foremost as an oncologist, thinking, is radiation valuable? In many cases, the answer is no. In some cases, the answer is yes. And so you want to see someone who really cares and thinks deeply about the overall picture, the patient as a whole, all of their medical factors, integrates with surgery, integrates with medical oncology, speaks team, and comes up with that comprehensive plan.
Do you have I don't mean to interrupt, but I just have a few more minutes to go, and I just want to get this. What do you suggest the patient do? Let's say when they find out. If I were to find out that I have cancer, the doctor just told me you have cancer and this is where it is. What is the patient's ability in this thing? Does the patient have, I believe that they should take charge of their own health. So what would you suggest that a patient, if the patient is advised that this is their problem, what do you suggest, a second opinion? Do they suggest you come to you? What do you have any suggestions?
So when I think they seek out good oncology care and someone that they feel like they can trust. So it's hard because a lot of times they don't know. So what happens is they go to their primary care doctor who sends them to an oncologist who's on the island. I mean, if a patient wants to come to me first, I'm open to that. And then I counsel them. And I tell every patient when I give a recommendation, whether mine is very, very standard, meaning I don't think anybody can disagree with me, and it really doesn't benefit you to get a second opinion.
Right.
It's always fine to get one. Or there's a significant chunk of the time where I say, look, this is controversial. You could easily find another person to give you a different opinion, and I try to counsel them on it. And I always encourage, even if my recommendation was one of the former, where I think it's really, really clear cut, having two heads weigh in and think about the case is always better. And I always encourage that for patients.
Well, I'm sorry, Rebecca.
Well, no, I was just going to say, because we're almost out of town.
I
know. So, our website, PacificCancerInstitute.com, or call us, look for us online. And, if you and a family member, be the advocate for that family member and contact us.
Well, I know it is important. Again, Dr. Benjamin Falit, and I thank you so much for joining us. I think what you're doing here on Maui is, I'd be happier for you being here, and I hope that you have a good time here on Maui. And I know our patients will benefit, all the patients on Maui will benefit from your expertise. Rebecca, thank you so much. You're a delight. You should see how beautiful this woman is.
That's a mirror I'm holding up. That's you're seeing.
Thank you for joining us. Until the next time, I'm Leona Rocha and
Rebecca Armato.
Aloha.
Aloha.